Hi, everyone. Welcome back to the show. I'm so excited that you're here. If you're new here, my name is Julia. I'm a registered dietitian. I'm based out of Vancouver, but I work with clients all over the world. And on my channel and podcast, you'll find tips to healing your gut and skin, especially eczema. And I often talk about nervous system because it's such a huge piece when it comes to chronic illness. And so if you want to learn more about gut and skin health and nervous system, then make sure you hit subscribe because I release weekly videos to help support your healing journey. Now, before we get into today's exciting episode, which is all about the 3 phases of healing inflammation, I have an exciting announcement. I'm offering free coaching. I'm so excited. This is something I've never done before. I probably hosted over 50 trainings and webinars in the past 6 years of running my practice, but never have I ever, except for next week, offered free coaching. So what this call is going to be about is it's going to be specifically for people who are dealing with gut issues, skin issues like eczema, and nervous system imbalance, which is likely a lot of you if you're listening to my episode or if you're a follower of mine on my podcast or on YouTube. In this free coaching call, you get a chance to submit your own question. It can be related to any of the topics, gut, skin, or nervous system. It could be any question that you feel like you need support with. I'm also going to provide general coaching as well. But what's so special about this call is that everybody gets a chance to receive personalized coaching from me. To sign up for this event, just go to the show notes below, leave your name, leave your email. The coaching call is going to be held on Monday, March 9th at 9 a.m. Pacific time. You really don't want to miss out on this one. I'm just ecstatic to host this call, and it's going to be so empowering, positive, and encouraging for your healing. I know a lot of us and a lot of you might be having a hard time with your symptoms and your journey. And so I really hope that this call is going to bring you light, bring you some more clarity and direction with your healing journey. That being said, as a disclaimer, this is not a call to diagnose. I'm not providing medical advice. I'm not a doctor. I'm a registered dietitian. It's for educational purposes. And we'll share all the housekeeping rules at the call itself. But if you want to join, be around other people who are also on their healing journeys and just get the support that you need at this moment, sign up below. So we'll see you there. And without further ado, let's get into today's episode, which is actually what I'm going to be talking about at the coaching call itself. It's similar topics. So today's episode, I'm going to be talking about the 3 phases of healing inflammation. This is going to apply to you if you're dealing with inflammation of any kind. Now, that could be inflammation on the skin, in the gut, in the mind, in your joints, with your hormones. It doesn't matter exactly where you're experiencing inflammation because we all know inflammation at the core starts with your diet, your lifestyle, and your nervous system. The 3 phases we're going to talk about is stabilizing, rebuilding, and optimizing, and what these particular phases mean and how it applies to you and your journey. I'm also going to be sharing some biggest mistakes that people are currently making when they're trying to heal from inflammation. Also, case examples of clients who are focusing on different phases in their healing journey and noticing improvement in focusing on the right phase. Of course, I'm going to share takeaways and actionable steps you can take to help support your own healing no matter which phase that you're in. One of the biggest mistakes that I see as a functional practitioner who uses an integrative root cause approach with addressing inflammation is that people are focusing on the wrong phase in their healing. And we'll talk about exactly what this means. But for the most part, a lot of people jump straight into dieting, straight into taking a bunch of supplements, trying to add nutritious foods, all the vitamins and minerals, doing advanced lab testing, but still not healing. The problem isn't that you're doing something wrong. I don't want you guys to think that you're doing anything wrong because when you follow a protocol from a practitioner, it's recommended by the practitioner, right? So of course you're going to listen to a trusted professional. Now, if it's not working, there's so many different reasons why healing might not be happening. But for the purpose of this episode, we're going to talk about why that is the case depending on which phase that you're in. The 3 phases are stabilizing, rebuilding, and optimizing. Most people jump straight into optimizing. In the optimizing phase is usually the last phase of healing. Symptoms are much more mild, there's less inflammation, the labs are pretty stable. You're optimizing your performance, your diet, you're taking away supplements supplements you no longer need. You're adding plant-based foods. You're optimizing what is already working. The problem with this is when you skip phase 1, stabilizing and rebuilding, and jumping into optimizing, your body is not ready at that point because you probably have really active flares right now. You have a lot of inflammation. That's usually what we do in phase 1. Most likely, if you're trying to heal your symptoms, you're in phase 1 right now. There might be a lot of inflammation. There's a lot of symptoms. You're in this panic state because you're experiencing these really intense symptoms. You don't want to be optimizing when you're still trying to figure out what is really going on at the root. Phase 1 is stabilizing. What that looks like is we're not trying to optimize. We're not trying to fix everything. We're not trying to chase root causes yet and not adding 12, 15, 20 supplements. When someone is a stabilized phase, they're likely dealing with severe flares, eczema flares, IBS flares, acne, severe pain, fatigue. Maybe they're experiencing recurrent infections, staph infections, skin infections, fungal infection, likely chronic stress or burnout from your personal life, but also dealing with your symptoms. Most of the time, people entering phase 1, they're not sleeping very well. Their sleep is quite disrupted. They're waking up during the night. There's a lot of overwhelm entering phase 1. So we don't want to be focusing on, oh, what exact foods you should eat. Let's take this specific probiotic. We're not quite there yet when you're in the early stages of healing. What we want to do in this phase is we need to calm the inflammation first. And sometimes that might look like short-term medical support, right? I always say it does take a team to address inflammation. It's not just your dietitian, it's not just your doctor, it's not just your therapist. You really need a team to address the inflammation. As a functional dietitian, we can help support you with the microbiome, with your diet. I'm trained in EFT, so I do sometimes help my patients with nervous system regulation. But if there's deep-rooted issues, I'm referring you out to a therapist. If you need to take a medication to calm the inflammation, whether it's an antibiotic because you have a suspected infection, obviously I can't prescribe medications, I can't recommend medications, so I'm going to refer you out to a physician. Sometimes medical support, other people on the team is needed during this stage when there's a lot of inflammation. Now, we also want to remove obvious triggers. If we know that stress is at large right now, we want to focus on reducing that, right? If you're taking a lot of supplements, sometimes that can be overactivating for people who have a lot of inflammation going on. We want to take away supplements. We don't want to add during this phase. And most importantly, calming inflammation at this stage is often nervous system balance because chances are, if you're listening right now and you're in phase 1, you are stressed, you are overwhelmed, you are so burnt out from all the things that you're trying to do to heal, on top of all the personal stuff that you might have going on as well. So we can't start adding supplements and focusing so much on diet when your nervous system doesn't even feel safe to allow those things to work. I have so many episodes on my channel that talk about nervous system safety, also my recent episode as well. So definitely check that out if you want to learn more about nervous system regulation, what safety really means, and how it's so important when it comes to implementing a protocol. But what I'm trying to say here is in the initial phase, we want to reduce nervous system threat. We need to calm the nervous system through different practices that you can implement, reduce the protocol overwhelm. If you feel like you've been doing a lot of protocols and it's not working, okay, we need to reduce the stress of needing to go on a protocol right away. That's the nervous system piece in phase 1 is stabilizing, right? Stabilizing the nervous system and focusing on the basics. So instead of adding in crazy protocols and detoxes, which I never do, the basics. Are you eating consistently? Are you getting adequate calories and protein? So important for healing inflammation. Are you having normal bowel movements? Those are basics, right? We need to focus on that first before we start tackling all the root causes right off the bat. We also don't want to be hypervigilant with our diet. If you're restricting your diet, that can actually contribute to inflammation because it's physical stress, because there's possibly nutrient deficiencies, you're probably not eating enough, and there's emotional stress, mental stress with the idea of needing to restrict. So we want to stabilize the foundations by not doing that. We want to focus on simplifying in this phase. Let me share with you a client example of exactly exactly this situation. I had a client come in, this was last year, with really severe eczema and TSW. She was terrified of food, avoiding histamine foods. She was on a vegan diet because she was not tolerating meat protein. She was taking a long list of supplements, but she was still flaring. She also had a lot of anxiety, a lot of stress from dealing with her health and her symptoms, and she was basically at a loss when she came to me. Instead of focusing on what else she could do next, what we did was actually simplify everything. We took away supplements she didn't need. We started introducing more nutrients and food into her diet while preventing reactions, and we did that with specific supplements. Nervous system regulation was a huge piece with her healing, and interestingly, she was doing too much nervous system regulation. Yes, that's actually a thing. And it all comes down to what her purpose was doing the nervous system work. And to her, it was forcing. She was forcing her nervous system regulation because in her mind, she thought that the more she does the nervous system tools and implement the nervous system tools, the more that she should heal. So that's desperation and that's control, right? I actually got her to do less of nervous system work and just used one tool. Within just 2 months, her flares decreased. She started healing. She started noticing her symptoms improving, even digestive symptoms, the anxiety improving, just everything. She just felt better. And it wasn't because we were fixing anything. We were stabilizing her because she came to me with so much inflammation and stress. We had to simplify and stabilize. If you want to hear her story, she actually left a beautiful Google review. I'll leave the link below as well, and you can read up on her story and also see her before and after photos, which is incredible. This example is to show you that more is not better. Doing everything in the beginning can actually backfire, which is exactly what my client was doing before we worked together. Now, how do you know if you are in the wrong phase? If you're a phase 1 person, which is likely the case for everybody, you always need to go in this order: phase 1, phase 2, phase 3. Stabilize, rebuild, and optimize. If you're in phase 1 and you're doing phase 3 things, again, taking too many supplements, going on restricted dieting, cutting out everything, trying to optimize, trying to do more testing, your body's not safe yet. Your body doesn't feel safe yet for those things to actually work. You need to take a step back and focus on phase 1, which we already talked about. We're going to take a quick break. I wanted to take a moment to talk about something I see all the time as a root cause dietitian. So many people are struggling with gut issues, eczema, inflammation, fatigue, blood sugar imbalance, you name it. And they've tried everything under the sun, but nothing is really sticking. They go to the doctor's office and the first thing they're given is a medication or a steroid to help their skin. And there's not a lot of conversation about addressing symptoms from a root cause perspective. And this is where I come in. I help people as a dietitian to get to the root cause of exactly what's going on and create a practical, personalized nutrition plan that actually makes a difference. No strict protocols, no restrictive dieting, and no detoxes. Just a clear plan that you can actually follow that is sustainable. And this is exactly what we do inside our group and one-on-one coaching services. We help our clients feel better in their bodies and actually become symptom-free. If this is something that you've been looking for, I would love to work with you. You can simply book a free consultation in the show notes below. The consultation is for me to understand your health goals, where you're feeling stuck, and how we might be able to support you. I would love to help you feel better, confident in your body, confident in your skin, and confident in yourself by healing from the inside out. Now, this is not a program that will just tell you what to do. This is a program where we work with you. We are by your side the entire time. We help you understand your symptoms and your body, and we combine nutrition with mind-body medicine. I'll leave the link in the show notes below for you to book a free call. Now, back to the episode. Okay, phase 2. This is the rebuilding stage. Now, this is the stage when the inflammation has really calmed down. It's much more controlled. There's no active infections going on. This is where the functional medicine tools can start to be implemented. The signs that tell us that you're ready to start rebuilding: you don't have any active infections going on, the flares are a lot less intense. They're still there, but they're not as intense. You have been taking your supplements pretty consistently, especially the core ones. You're less reactive, so you're not just like flaring from everything. And of course, your nervous system is much more calmer. Now the body has capacity. Now the body feels safe to implement the next step, the phase 2. Typically, in this phase, we focus on rebuilding the gut barrier integrity. We focus on supporting microbial diversity. We're adding micronutrients. And then we also do some lab testing here as well. So this might be the phase where we do GI map test to see if there's anything else that's going on in the gut. We run nutrient labs as well to see if there's any deficiencies. And then we're slowly adding supplements to target your root causes. And since your body should be less reactive at this point, this is when we can start gradually adding more foods. We may be adding targeted probiotics. And sometimes we don't do this for our phase 1 clients because if they're reactive, adding probiotics can stimulate your immune system even more, depending on how sensitive you are. So we do want to wait until you're less reactive, more stabilized before we introduce specific probiotics. Also, probiotics aren't the end all be all as well. So, there's always a time and place for different supplements. There's always different phases we need to think about when we are introducing supplements. I have an example of a client who was in this phase. So I worked with a client whose eczema was in phase 1, so pretty severe for a period of time. I would say like 2-3 months of flaring. And after we calmed down the inflammation initially, that's when we actually started looking at labs. Because what's actually interesting is certain labs can be affected by how much inflammation you have going on. Ferritin, which is your iron storage, actually increases when there's inflammation. That's interesting, right? So if you're testing for ferritin, which is something I really look at, especially for women, low ferritin is very common, especially with eczema. If you have active inflammation going on, your ferritin is going to be falsely high. And we don't want that, right? I want your actual ferritin level. So we need to wait until inflammation has calmed down before we test nutrients, especially for ferritin. So with this client, after we stabilized her, looked at her nutrient levels, specifically ferritin and vitamin D, and she was both low. So what we did as a part of the rebuild stage is that we're adding supplements into her routine, specifically iron supplements and vitamin D supplements. We also focus on expanding her diet. We were trying to add in more carbs because she was reacting to carbs previously, expanding her diet, expanding her fiber diversity, polyphenol-rich foods, and prebiotic foods. This is what we work on in the rebuilding stage. And notice that we didn't do any of this during crisis, the active inflammation stage, because it's not going to work. It's going to cause more stress when you have to do all these things. We did it when her system could actually respond. So that's phase 2. Phase 3 is optimize. I love this stage because at this stage, my clients are doing a lot better. We just need to fine tune what we're already doing and stay consistent. This is the stage when symptoms are mild. Still may have some symptoms, but it's nowhere like it was back in phase 1. Also, in terms of how long each phase lasts, it depends on the person, okay? Sometimes we see people in phase 1, takes 1 month for them to really calm down symptoms. Phase 2 can take longer, depends on medical history, depends on their labs, depend on how their body responds to the protocol. That can take 3 months up to a year. Healing from dysbiosis in the gut, leaky gut, healing from chronic inflammation, especially if it's been built up for so long, it's not that easy, okay? It can take time. That being said, that's why the range depends on the person. It could be 3 months, it could be a year. Phase 3 is the optimized phase. This is when symptoms are a lot more mild, the labs are more normal, inflammation is less. Overall, people are really improving at this stage. In the optimized stage, this is when we want to look at how consistent you are with your protein, with achieving 30 different plants throughout the week, how stable your blood sugars are, meaning are you eating regularly or are you skipping meals? You're also able to tolerate most foods and consistently, meaning you don't have any food restrictions or you're noticing that you don't react as much as you used to in phase 1 or phase 2. In this stage, I also like to focus on skin barrier healing because when your skin is flaring in phase 1 or phase 2, you can't really support it as much as we want to because when your skin is already inflamed, putting things on it kind of irritates it some more. Now, by phase 3, your skin should be much more stable. So this is when we want to focus on a good skincare routine to prevent future flares from happening. We want to refine your skincare, focus on barrier support, improve texture, reduce hyperpigmentation, which is actually huge in a lot of clients. After they've gone through the phases of flaring to healing, their skin is no longer red in phase 3, but now they're noticing more dryness, more wrinkling. They need some collagen support and hyperpigmentation supplementation. Skincare is quite important in every single phase, different skincare in different phases, but in phase 3 specifically, we're trying to refine your skincare to keep your skin barrier strong so that we prevent future flares from happening. This is also the phase where my clients start to focus on other goals. Okay, their inflammation is well controlled now. Now I want to be able to exercise more and build muscle mass. Okay, great. Now we're focusing long-term goals. How to exercise without your skin flaring? What does your protein intake look like at this point? And also they want to continue focus on nervous system regulation. That is something that is going to be a forever thing people want to focus on. That is something that doesn't just end, right? Healing never just ends. Taking care of your body never just ends. So we always want to be optimizing. We always want to be regulating our nervous system because life happens, stress happens, events happen. So we want to build resilience and optimize our bodies so that when stressful events happen unexpectedly, you don't go into a huge flare. That's what optimizing in phase 3 is all about. Think about when you go to the dentist, right? This is a really good example. If you have a tooth infection, we're going to treat it, right? That's phase 1. We want to stabilize the crisis. You want to get rid of the infection in phase 1, and you see your dentist to fix that. And if you have a cavity, that's phase 2 because you need to repair the cavity, you get your fillings in, right? You get your teeth cleaned. That's the repair phase. However, you don't just see your dentist for phase 1 and phase 2 and call it a day. Once your teeth are healthy, you need to check in to make sure that your teeth remain healthy. You don't stop seeing the dentist forever. This is why your dentist always recommends getting your cleaning done every 6 months, no longer than a year, because maintenance is really important to prevent crisis, to prevent infections, to prevent going back to phase 1 again, which is when there's a lot of inflammation going on. Same thing when it comes to your health and your symptoms. If you're someone that's prone to eczema because it's in your genetics, you always want to be maintaining your skin. That doesn't mean you have to be perfect with your diet and perfect with your protocol. I'm not saying that at all, but we don't want to fall off the rails, right? So check in with your dietitian every 3 to 6 months, have it in the calendar. If you need to cancel your appointment, that's fine, but at least have the accountability and have the support to keep you on track. That's basically the 3 phases of healing inflammation, stabilizing, rebuilding, and optimizing. I want you guys to reflect on what phase that you're in right now and how you can approach healing depending on which phase you're in. And again, if you're phase 1 and you're focusing too much on phase 2 and phase 3, then I invite you to strip it back and focus on the foundations. I do this with my clients, really help them in this phase. A lot of my clients come to me, they're already in this phase. There's a lot of inflammation. So you can book a free consult in the show notes and we can talk about what that would look like and how we can support you. If you're in a good place right now, you're actually in phase 3, start thinking about how you can maintain that because that's also really important as well. If you want to learn more about these phases and how to heal, then come to my free coaching call. And if you have questions, honestly, if you have more questions about anything that I talked about today and you want to receive coaching, come to my coaching call next week. It's on Monday, March 9th at 9 a.m. PST. You get to submit your own question before the call and I'll answer it directly on the call. If you can't attend live, no worries. We will send you the replay and your question will still be answered as long as you submit your question. And I'm really excited to see you guys there on Monday, March 9th. Thank you so much for tuning in. Make sure you hit subscribe if you haven't already. We release weekly episodes on the channel. Have a lovely rest of your day. It's a beautiful sunny day in Vancouver. It's actually the last sunny day before back to the rain. So I'm going to go out and enjoy it. I hope you have a great day and we will see you in the next episode or on Monday.